the call of the roll.
Sure. Commissioner Chow,
Present.
Commissioner Dorado,
Present.
Commissioner Guillermo.
Present.
And I will read the land acknowledgement. The San Francisco Health Commission acknowledges that we are on the unceded ancestral homeland of the Ramaytush Ohlone, who were the original inhabitants of the San Francisco Peninsula. As the indigenous stewards of this land and in accordance with their traditions, the Ramaytush Ohlone have never ceded, lost, nor forgotten their responsibilities as the caretakers of this place, as well as for all peoples who reside in their traditional territory. As guests, we recognize that we benefit from living and working on their traditional homeland. We wish to pay our respects by acknowledging the ancestors, elders, and relatives of the Ramaytush Ohlone community and by affirming their sovereign rights as First Peoples. So everyone, we're going to take the agenda a little bit out of order because we have some issues with commissioners. So we'll move directly into item 3, the monthly contracts report. And on that report, we'll start with the Chinese hospital contract. And with that in mind, Dr. Chow, if you would go off camera and off microphone during this discussion.
Yes, I will, and you'll then text me as to when we can come back,
Yes,
right?
sir.
And
I will. It shouldn't be that long.
And I'll ask Commissioner Guillermo, please, to help chair this part of the meeting. And I really thank Commissioner Gerardo for making the time to be with us so that we can hear all the items. Thank you.
Thanks, Dr. Chow. All right, Ms. Ruggles and Ms. Hiramoto.
Hi, thank you. Good afternoon. Thank you very much for joining this important tract and all of them with this first. So this is the Chinese hospital station. What we're getting today.
I'm sorry, Michelle, your bandwidth isn't great. Can you turn off your video so we can get the sound? You're a little bit choppy.
Okay. Can you hear me now?
Oh, it's still a little choppy. Go ahead, though, and let's see how it goes.
Hang on, I'm seeing it. Okay. So today we tried right now. It is the Chinese Hospital Association. Can you hear me?
Yes, but it really is breaking up. Is it possible for Ms. Hiramoto to do the review of that? Or I'm not sure, Ms. Hiramoto, if that's okay to ask you to do. Or Michelle, if you can call in, I'm not sure what to offer.
Kelly, can you have it up?
Sure. This is a modification. This is a modification for the contract to provide acute hospital and skilled nursing facility surge overflow for San Francisco General Hospital. We are requesting to continue these beds for another year, anticipating that we may need additional surge during this pandemic time. I'm sorry, I'm Kelly Hiramoto. I'm Special Projects Manager with the Department of Public Health.
Commissioner,
Okay,
any questions? Oh, I'm sorry.
Yeah, thank you, Kelly, and thanks, Michelle, for trying to work this through. It seems pretty straightforward. Are there any questions, Commissioner Gerardo?
No questions. No, I was just unmuting myself for the vote.
Okay, okay. And I don't either. I do know that it does note that this is a retroactive contract, so we just want to make sure that we understand that that there's, obviously logical reasons for that given the surge. So if there are no other questions, I don't know if there's any public comment.
There's no one on the line, and I'm going to note again for the record that we're pulling this contract out for a separate vote because Commissioner Chow has a conflict. So if you two could make the motion to vote on this, and then Commissioner Gerardo can bid us adieu, and then we can invite Dr. Chow to come back and do the rest, if that's okay.
Okay. So then if I can have a motion to approve?
I so move to approve the contract with Chinese Hospital.
And I will second.
Great. And with the two of you, there's no need for a vote because if two commissioners are in the room, all we need is those two things. So thank you, Commissioner Gerardo. I'm going to get Commissioner Chow to come back. We're very happy that you're able to join us and make this happen.
Thank you, Commissioners.
Thank you.
You're welcome.
Thank you. Thanks, Ms. Hiramoto.
See you at 4.
Can you guys hear me now?
Yeah, Michelle, it's still breaking up, so not sure what to do at this point, but I think you just have a bad connection generally.
Okay. All right.
Right, and thank you, Commissioner Guillermo, for chairing that portion of it. And at our full commission meeting, you can give that part of the report also.
And Commissioner Chow, Ms. Ruggles is still having issues. Ms. Ruggles, do you have the agenda in front of you? Because you could call in the public comment line, and I could unmute you, so that would be a clear connection. Do you have that?
I'll get it.
I will send it to you right now. Because I want to make sure that we're hearing you. Okay.
While we're doing that, we could do the approval of the minutes.
Sure.
But if we get a motion for the approval of the minutes.
I will move approval of the minutes.
And I would second that.
All right. With the two of you, that's all we need. And if you can give me, I'm just typing in the numbers for Ms. Ruggles. Give me.
Sure.
Do this. Thank you for your patience, everybody. Yes, today's one of those days. Okay, Ms. Ruggles, I just sent that email. Hopefully that will be helpful for you to get on. And once I see you, I can unmute you. Just for everyone on the meeting, the Health Commission is scheduled to go back to in-person meetings starting March 1st. So this may be our last remote meeting. We're not quite sure if that's actually going to happen, but that's what we've been told by the mayor's office.
Geez, that'll be actually about 2 years exactly, right?
Yes, it was March 17th was our first remote meeting. So yes, good times. And it will be the in-person meetings will have a hybrid public comment component. So we will still be using the WebEx, but the commissioners and I will be in person, and hopefully most staff will be too. Ms. Ruggles, keep us posted on how you're doing. And commissioners, while we're here, we can go through, are there any emerging issues? Item 4.
None from me.
Okay, great. And then I'm not seeing anything on public comment, so I think we've taken care of those. I see Ms. Ruggles is here, and I've unmuted you, Michelle, so see if that works.
Am I echoing?
No, it's good.
Oh. Okay.
Very good. Thank you. So let us proceed then with the rest of the contracts report. You want to call the items?
Oh, sure. Well, Ms. Ruggles can start with the Alternative Family Services contract.
Thank you.
Okay, so I sound like I'm echoing to me, but not to you guys?
No, but so, maybe turn off the sound on your computer screen. That will stop the echo for you, but there's no echo on our end.
All right, can you still hear me?
Yes.
Guys, sorry about this. It's only been 2 years. I don't know why that's happening, but anyway, thank you. So, okay, hello. The first contract before you is the the second contract is Alternative Family Services, Inc. And what we're requesting today, this is an ongoing contract that you last approved on October 6th, 2020. So what we're doing today is seeking an amendment that will extend the term through the authorized term of the solicitation and then add in the associated additional funding. Just to note, the current contract that you've approved goes through June 30th, 2022, and that funds 3 primary services: outpatient, therapeutic visitation services and therapeutic foster care. The extension period is for the outpatient services. The other two services will drop out of this contract because they're subject to being rebid. And so they'll come back as a separate contract at that time. So nothing has changed except that from before, the services are the same. And if you have questions, I'm happy to answer them.
Commissioners, any questions?
Commissioner, do we have any, did you have any questions on this?
No, I don't have any questions.
Thank you. I'm just trying to clarify, Ms. Ruggles, you said that the outpatient services were going to remain. So in the service block, does that mean that the 24-hour foster care is dropped, or what is actually dropped according to here?
It's still in here because it's been in the prior contract, and it's it's been in the prior contract, and then it's going to. We didn't change the service description, but what will drop out is therapeutic visitation and treatment foster care services, which are the first two things in the service description.
Oh,
And then,
therapeutic visitation and treatment foster care services are dropping out.
yeah, after starting July 1st, 2023.
Okay, because they're going to be rebid. Okay.
I mean, July 1st, yes.
July 1st, 23. So this extension is to 27. I see. So
Right.
they're going to continue for another year and a half, right?
Correct, right.
Doing these. And then will the amount drop, or has the amount dropped? Because you show an annual difference of about 10% at this point.
Yeah, so the amount will drop moving forward. All of that funding will come out.
Okay, so that gets adjusted. In the NLC section, I was trying to, as I think we forwarded to you, are these the number of clients that they were caring for, and why are there just low numbers, or is that these are people who have care every 12 months or 12 weeks or what?
I must have missed an email with the follow-up questions, so I don't have an answer to that. But your question is why the number, how did they arrive at the number of annual clients being served?
Right, because I mean, it looks like it's a little lower than one might have expected, right, from a contract of this size.
Yeah.
For example,
No,
mental health
yeah,
services
yeah.
are only 73 people, if those are the people actually.
Yeah, so I need to check, and I'm sorry, I didn't see that before. I'll check on the annual
Okay,
numbers.
all right. I don't have any other questions. I think you helped clarify that although the extension is to 27, as you said, therapeutic visitation and treatment foster care services drop out in July of 23. And therefore, while we're approving this amount at this point, there actually will be less expenditure, right, in those years
Correct.
subsequent.
Yeah,
Okay, thank you.
Uh-huh.
Oh, I had one other question. How is our for the alternative family services? How were their ratings in terms of their annual follow-up?
So the alternative family services, like with our other contracts, the scoring didn't occur in 2021. They went out, and actually they're catching up right now in 2021. In the 1920, which is in the performance outcome summary, they met 57.5% of their contracted performance objectives and 83.6% of their contracted units of service, and there weren't any compliance issues noted.
Okay, so was there a reason that they only met half of their targets? The 57%?
Yeah, I'll, um,
And had we, I actually didn't see the performance in my packet. So Mark, did we send that out?
I sent that out yesterday, Dr. Chow. I'll re-email that to you right now.
Oh, I'm sorry. I didn't see it yesterday.
Yeah.
let me just quickly look at this.
So I think, Michelle, not that we don't need these services, and thank you for the 57%, but perhaps just as a follow-up to
Yeah,
the Finance Committee could just have something forwarded to us.
definitely. Sorry, sorry, I didn't even notice that. Okay, yes, for sure.
You know, if I can ask a question.
Sure, absolutely.
I'm thinking in light of this, and I don't know, Michelle, if it's because you're sort of trying to juggle the phone and the computer, but you know, for these kinds of questions in terms of, you know, the number of clients not quite matching up to what the budget looks like it should support, you know, that kind of thing, it might be helpful in the future that we have somebody programmatically that is you know, who would know about the numbers and their performance to be able to answer any questions.
Yes,
Um,
you are
because otherwise
completely, yeah,
it's, uh,
yeah,
um, you know, that the struggle, you know, of trying to look things up at the last minute wouldn't be an issue if we had somebody who was so familiar with the execution of the program.
yes.
And
You
it's
are 100% correct, and that is normally what we do. We have a backup person for each contract, and we don't today. So it's been crazy to say the least to pull anything together. So I apologize, but I hear you. And yes, we'll make sure that someone is there and get back to you with the answers to your questions.
Thank you. I know that usually we're really right on the ball with the number of staff there. And I did notice that you did have Jan Zhang, our CEO from the Chinese hospital, on in case there was a question. So uh, I think that it would be also, and I would second the fact that we realize you can't know all the answers to everything here. And so we appreciate that. And I think if Commissioner Guillermo was okay, we could just get a written report about this part of it, just to understand the sense of the numbers. I'm sure that there was good reason for what appears to be too low a number. So maybe they're not just counting the way we normally count.
yeah,
Uh,
yeah, because it, you know, and it says it's annual numbers, but you know, to have a budget like that supporting those kind of numbers is really,
Yep.
you know, it's questionable. Yeah.
Yeah. So I will definitely come back to you. I'm sorry for the lack of preparation.
Okay.
We
Thank you.
move on, commissioners, to the next
Yeah,
contract.
let's move on to the next one then. And
Great.
I
The
think
next,
for this one, you're also stuck with me, but after that, there's a backup person.
oh no,
But
no.
this one may be straightforward enough, but who knows what I didn't notice. So this is Fort Help. This is approval of a contract amendment, and we are extending this contract because we are needing to take it to the Board of Supervisors. We're extending it through its term that is authorized by the RFP. And this program serves people that are addicted to or abusing or relapsing from opioids. The contract, they really have two programs that are in separate contracts. They have a Bryant Street Clinic and a Mission Street Clinic, and both of those programs met, well, the one that's before you today met 95% of their contracted performance objectives, and 67% of their contracted units of service. Their client satisfaction was, they met their requirements of how many people participated, and they had 80 to 89% saying that they were indicated they were satisfied. So that is the contract before you today. We didn't increase the funding. It's the same funding each year, but like all our contracts, there's a annual contingent. I mean, there's a contingency so that should there be rate increases, then the rate increases can be added in through an amendment or a modification to the contract.
Commissioner Guillermo?
No questions.
Okay, so you're saying that there's a Bryant and a Mission Street, and this one is just one of them?
Yes, it's Bryant.
And this is Bryant. Okay,
Yeah,
I got you. Okay. And so the contract, there are two separate contracts then?
correct.
Okay. And so in this one, I guess when and this is more if you don't meet all the contracted units of service, and that kind of goes with what we said earlier, then is this paid by the numbers of services, or they're able to get their full amount because they get a monthly, capitation, so to speak?
No, this is based on fee for service. So if they don't have enough, if they don't, I guess probably the most likely, if they don't have enough clients to meet their capacity that we contracted with them, then they'll just be paid less.
Sure. And so the fiscal year 19 to 20 does include then about a half year, or certainly a third of the COVID, right?
It probably, yeah, it started in March 2020.
Right. So so if this extends what to July, then that could well account for some of the lower contracted units of service, it would look to me.
Yeah.
Yeah. Okay. No, thank you. Okay, this is the Bryan Street, and if we have no further questions, we then can go on to our next contract.
Okay. So the next contract is Project Open Hand. And this is a contract that you've also approved, actually not that long ago, April 2nd, 2021. What we're asking for today is a contract amendment to increase the total contract amount to $18,800,344, and then the funding, what that supports is an extension of the contract term. So this is also a contract that we'll be taking to the Board of Supervisors, and this increase, well, so the increase, what we did is increase funding to support the additional term. Sorry, that wasn't that difficult to say. The services are essentially the same. They support food delivery, as well as they operate a food grocery center, giving grocery bags and frozen meals, and then also delivering food to people that need it to be delivered to them. Anyway, that's there's the change. Well, anyway, that's, I think the rest is in there, but there is someone here if you have programmatic questions.
I had a question.
Yes, please.
So it's an increase of the amount in order to extend the contract for 10 years, but the taking out the one-time funding of the Ryan White funds. That's correct. So it's a and when was that that Ryan White? Oh, I see, it's here. The Ryan White funding.
It happens
Is
quite often with the Ryan White funding, is that at the end of the year there's something left and it gets added into another contract, and then we often come back because we've exceeded the contingency amount.
Mhm.
But I think the ongoing funding that is in the extension is what's in the baseline and what aligns with the grant funding or general fund funding.
okay. So other than that Ryan White decrease, then you were essentially being asked to approve a continuing contract. with
Correct.
Additional. Okay. Thank you.
Mhm.
Thank you. And I'm just reading, there are two sections in your evaluation, and the evaluation, of course, is quite good. So they both say open hand food and nutrition services. So what is the difference between the two?
Would you like me to jump in, Michelle?
Thanks.
Hi, Commissioners. In addition to providing food, both as prepared meals and bags of groceries, they also provide nutrition counseling. A lot of the persons living with HIV who are clients there that we fund these services for have medically tailored needs, either living with diabetes or heart disease, or have other conditions which they meet with the dietitian there to get some nutrition counseling and support in making diet decisions. So we fund food and that nutrition counseling as well.
Okay, so I mean, the reason thank you that I'm looking at this is that, and excuse me, because this is something I missed when it came through yesterday. It says that there are two different evaluations. So is one for the delivery of the food, I mean, cooking and delivery of the food, and which one is for then the nutrition services? There is one that has in parentheses GTZ.
That's the getting to zero general fund funded portion. There's the Ryan White Part B, which is federal dollars that come to us through the state, which funds the food and the nutrition counseling. And the general fund getting to zero was funding added to this through the getting to zero process. As you know, getting to zero is about getting to zero HIV deaths, zero stigma, and zero new infections. And this is about addressing the stigma part. So they're delivering food in the Mission and the Bayview and Southeast to clinics at Mission Neighborhood Health Center and Southeast Health Center to directly connect with the clients there who might have either issues getting from those areas of the city to Project Open Hand, or experience stigma of going into a large building with 3 HIV/AIDS organizations. So this was one of the expansions of the Getting to Zero efforts in 2017.
Oh, okay. So there are two different funding sources. So we have two evaluations, and it would seem that Project Open Hand does such a great job, at least in the second portion of the Getting to Zero, that they've had 280% of the contracted unduplicated client. Just amazing, and
They do great work.
and in the previous one, it's 687%. Are those numbers correct?
Yeah, yes.
Yes.
And they move around a little bit, as you can see, since that began being funded about coming on 5 years ago. Those numbers have moved, and they've probably really been impacted by COVID, to be honest. But
Sure.
yeah, they serve a very large
That's
number.
great work.
Yeah,
I mean, that's really amazing, and I'm more than impressed. I've always been impressed with Project Open Hand. I visited their kitchens before, and this just seems that they've continued to do a great job for the community.
agreed.
Any other questions, Commissioner? So,
Thank you.
Is it okay to move
Okay.
on to the next contract, Commissioner?
thank you. Let's move on.
Great.
Okay, the next contract is the San Francisco AIDS Foundation. And so similarly to the other contracts, we are requesting an amendment to the contract, which would, in this case, the term is not changing, but we're adding funding into the contract to reflect changes that have occurred. And so in this one, for example, the you can see the change under reason for funding change, but there's an increase of $340,000, which is due to CDC grant funding in the amount of $245,000 in 21-22, and then there was carry forward funding. There was a cost of doing business amount, and then an adjustment to the contingency. And so all of that resulted in the need to add an additional $340,280 to the total not to exceed amount, but not changing the grant or the, sorry, contract term. And the additional funding is continuing to support the additional services. I believe there is someone here if you have program questions.
Okay. So, Commissioner, questions?
Just I think it's a timing question. So the additional funding from the CDC for fiscal 21-22. So is that's funding that only takes us to June 30, 22? And we're being asked to approve the contract. Wait, so we're being asked to approve this amendment to reflect the CDC funding amount, but that was for fiscal 21-22, right?
Correct. So there's a bunch of changes. Well, there's like a handful.
Right,
So it's
but
the
that
CDC
was-
grant, the carry forward, the contingency adjustment. So it's reflecting as much funding as we're aware of that will need to be included in that total funding to fully fund the contract through June 30th, 2025.
Okay. Okay. Thank you.
I'm very appreciative of Commissioner Guillermo trying to figure out all of these funding sources. And I know that again, we just have to get used to the fact that there are also, according to your performance backup, 4 different levels of I guess, reports due, but each of them seem, at least the first 2 that were valuable, seemed quite good. The others, I guess the whole program was suspended during COVID?
No, not the program. What some of the program monitoring was
Oh, it's
suspended.
Okay, right.
And so where applicable, there were program reviews like desk audits because they couldn't go into the locations. And so they monitored everything that they could from like receiving information from the vendor without like going on site and confirming that, posted things really were posted.
Sure.
And then normally all of the things that are monitored add up, weighted, they become a score. And so what was suspended also was the scoring. It didn't seem fair to, score the number of clients
No,
against the budget during a pandemic.
very understandable. And we know of their work, and it looks like they're carrying on through this pandemic. So if we have no other questions, we can go on to, let's see, Chinese was next, but you were taking care of that. So what's our next one here? It looks like Homeless Children's Network.
Homeless Children's Network.
Yes.
And I do not think that there is anyone on here. Okay, so what this is Homeless Children's Network. This is one of 2 contracts that we have with this agency. This is a request to increase the total contract amount and to extend the contract by 2 years. So this is a contract, the reason, or really the primary reason that it's grown and that it needed to be brought here today is that there was funding added through for COVID and for the Dreamkeeper initiative. And so the Dreamkeeper initiative funding was first added in 2021 and then carried forward into 21-22. And then anyway, you can see explained in the reason for the change. The Homeless Children Network serves Black African American children, their families, and adults in San Francisco. They're primarily serving those living in emergency, domestic violence, and transitional shelters, as well as the families referred by homeless agencies. So, and anyway, you can read the rest of that, or maybe you already did. But they are a hub citywide collaborative of agencies that provide services to the Black African American children and their children and their families. I don't know why that says American families. So anyway, that is that. And anyway, if you have questions, not sure I'll know the answer, but
Commissioner Guillermo?
No, I don't have any questions. It looks like we're just doing a lot of catch up, right? On all these different contracts. So just wanting to make sure that I'm getting it all straight. So thanks.
sure.
And I'm guessing, I think I misread the title because now that I understand better, because I was trying to figure it out, but I see homeless children are not children who are homeless without a family, but have families, and that this takes care of the children portion of those people who are homeless. Is that about right? I think you're on mute of some sort.
Yeah, no, I would say, no, I was just, I think it serves the children and their families.
Yes.
And so,
Okay.
I mean, I would say yes, based on what I've read, but they could be, yes, I would assume that they are mostly homeless based on where the designated living, where they
Right.
live, the target population. I did just want to comment, we're doing catch up, but we're also extending the terms. And so what we're trying to avoid is, you can see the current contract term ends June 30th, 2022. And so while we may have sufficient funding to get through 2022, we want the contract to be amended before it runs out. And so what we're trying to do actually is get ahead so that we can get this to the Board of Supervisors before they run out of funding. And so in explaining the difference, we're explaining what's changed this year. So it doesn't, like, we haven't gone beyond what you've already approved. Right. I think for Chinese Hospital, that one is definitely was a catch up because that one expired December 31st, but this one is okay. But what we're trying to do is get all these contracts that are expiring June 30th, 22 and require Board of Supervisors approval, like actually in the hopper.
Mm-hmm.
Yeah, and it would be fair to say one of the reasons also for trying to extend is because you're all overstretched and you really do need the extra time to continue services, but then work on, are we going to rebid these or?
Well, if we have an eligible term through a solicitation, as long as we are happy with the services, we typically extend through the authorized term. And so if the authorized term brings the contract to 10 years or brings the total contract funding to 10 million, then we have to get approval by the Board of Supervisors. And until we get that approval by the board, we can't continue the funding. So you can see a lot of these, the current term ends June 30th, 22. And so even now, it'll still be a scramble to get it through the board. Sometimes it can take 6 weeks to get it scheduled. And then if you hit the city's budget process, then they stop taking new items. So really our primary goal that we try very hard to hit, not always successfully, is to keep cash flow going without interruption. So what we don't want to have happen is those June 30th, 22 contracts to expire.
Sure, no, I understand that. I think for background also, if I recall, we've talked about what the length of a contract should be and how to balance that with the work in recontracting. Mm-hmm. And in the past, we thought a full 10 years would be too much in terms of just letting a contract, perform through a 10-year period. And so I'm very appreciative that you're bringing it back. And that was why we were using, I think, 5-year terms in general, right, Michelle?
Yeah, so typically that's exactly right. We typically don't do anything longer to begin with than a 5-year term. But if everything is going fine and the RFP allows it, then we'll extend it. But not we don't usually ever, that I know of, come in with a 10-year term request up front.
Right. Okay, so if we have no further questions, we can, Commissioner Guillermo, did you have a comment on that?
No, I was getting ready to make a motion.
Oh, I see, to make the motion, okay. So you've already made the motion on the Chinese Association, which I'll let you report. So can we have a motion for the remainder of the contracts report?
I move approval of the docket of contracts separate from Chinese Hospital. Yeah.
Okay, so that's a recommendation to the commission for approval. And I would then second that. And
Great.
I think according to Mr. Morwich, we will then have passed it, right?
Yes, that's all we need for two people in a room.
Okay.
Commissioners, and thank you everyone, Ms. Ruggles and the other presenters.
Thank
So
you.
we've already gone through emerging issues and public comment. So commissioners, you may consider a motion to adjourn if you'd like.
Okay, I'll move adjournment.
Okay, and I will second that. So our meeting is now adjourned. Thank you, everybody, for your work.
See you in a little